People are finally starting to talk about the healthcare system in America and how messed up it is. What I don't think people realize is a lot of their issues is because of Obamacare.
During the campaign, you had concepts of a plan. Do you have an actual plan at this point for healthcare?
Yes, we have concepts of a plan that would be better.
Still just concepts? Do you have a fully developed plan?
Let me explain. We have the biggest healthcare companies looking at it. We have doctors. We're always looking because Obamacare stinks. It's lousy. There are better answers. If we come up with a better answer, I would present that answer to Democrats and to everybody else, and I do something about it.
Why am I paying $500 a month for health insurance that doesn't want to cover anything?
Hey guys, welcome back again to the channel. It's so good to have you. Thank you so much for clicking when you saw this video. So in today's video,
You know, one good thing that came out of this whole Luigi United Healthcare issue is people are finally starting to talk about the healthcare system in America and how messed up it is. What I don't think people realize is a lot of their issues is because of Obamacare. Yes, Obamacare had a lot of good ideas, but it didn't work for the vast majority of Americans. What it allowed was for people with pre-existing conditions who used to not be able to get health insurance, and people who couldn't afford health insurance at the time to be able to get health insurance, which is awesome. However, because of that, the insurance companies had to raise their premiums for all of the other people outside of those two circumstances. So if you didn't meet the eligibility financially for Obamacare, and if you didn't have pre-existing conditions, your insurance rate skyrocketed through the roof. That's the part of Obamacare that people don't talk about, because when you hear Obamacare, you hear about the Affordable Care Act, and it made health insurance affordable. Only made health insurance affordable for people who couldn't afford health insurance to begin with. For the people who did have insurance already, it just made them skyrocket. So the majority of middle-class Americans are paying for that.
now it is the same middle class that voted TP in, and they are the one that is going to be suffering for all of this because they are the one that voted against Obamacare, thinking that it was not linked to Affordable Care Act. And they are the one that is going to suffering. They're the one that will suffer for all of these things, right? So I don't really understand what this lady is saying, but if you do, let us know what you think in the comments. But when I went through the comment section, I saw a lot of people come for her and was asking her, what are you even saying? The rich are not complaining. It is still the people who do not have at all that are complaining. And these are the people who really did the whole voting thing. They're the one that came out in mass to vote.
Okay, I'm sitting in my office. I'm whispering because this is unbelievable. This is my first opportunity to share. This is my first TikTok. But I had to come to my black women and share this. It has been a week. I'm still in my feelings, but that's beside the point. So I'm a health insurance broker. I'm actually a broker, but I do health insurance. So Medicare, it's busy season, individual, family, small businesses. That's what I do. I got a referral, right? About 2 weeks ago, one of my longtime clients sent me a referral. They had their appointment this morning at 9:15. They come in, it's a husband and wife. He got laid off from his job. They need insurance to start December 1st. I'm like, okay, no problem. Intake sheet. Most of my clients come from referral. No problem. They come in. I know what the situation is. I know most of the information that I need, but meet in person, let's go through all the things, what medications you have, all that stuff, right? We're going through the information. We sit down, we're in my office, we're sitting down at the conference table. I'm like, okay. So as we're talking and we're going through, chit-chatting, the husband goes, because, I don't want Obamacare. And I'm like, in my head, I'm like, so what the hell are you doing here? You don't want Obamacare. Well, sir, I guess you're at the wrong place. He was like, what do you mean? The ACA is Obamacare. I'm not really sure what are you talking about? He said, I need the ACA. I don't need Obamacare. I proceeded to close my stuff. And I was like, I think it's time for you to go. So he was like, well, why? Sir, the ACA, the Affordable Care Act, dubbed Obamacare by the far right 10 years ago, by that black man who was in office in 2008 that passed in 2010, is Obamacare. So you're sitting in my office for the insurance plan through healthcare.gov in the state of red Georgia that you need to start in December because you have pre-existing conditions, diabetes, and early onset cancer, and you lost your job and you needed to start December 1st, but you don't want Obamacare. It's time for you to get out of my office. So of course, now I understand how that 52%, how it really works out in full time, in real time, because the wife jumps up and she's like, oh, no. Start apologizing for him because she's like, oh, I'm so sorry. No. You don't have to be sorry. Y'all could get on up because this is not what we're going to do here today. Okay? This is not what we're going to do. So you can get up and thank you very much. And you can go. I don't think this is going to be a relationship that we can do. You can get up and go. Thank you for your time. Thank you for coming in. But I don't think this is going to be a fruitful relationship. Perhaps, you can find a different broker that can assist you in the insurance that you need to get in the next 15 or 16 days to start on December 1st and actually know what they're doing. Because I've been doing this now for 20 years, and I started with the ACA. I am like a top broker with the ACA, healthcare.gov, and in the state of Georgia. So feel free to go find somebody else who can help you. Okay? So, of course, the woman's like, no, apologizing for him. And I'm sitting there like, nah. So he still does not believe that the ACA is Obamacare. So I come on over to my desktop, and I type in ACA. I type in Obamacare. I show him. I really don't know what silo you've been living in for the last 10 years, but here you go. Print out the information. I hand it to them, and I was like, thank you for your time. I opened the door. Goodbye. I let them out, and I give my client, my longtime client, who was the referral, a call, and I let her know exactly what happened. And do you know what my client tells me? She said, I figured that if he says something out of sorts, that you were the right one to put him in his place. I said, why didn't you tell me what you were sending me? She said, because usually he could keep his shit to himself. But, sometimes when you feel big in your britches, you think you won something, but you really lost. I said, so, and she literally said, I guess we in the find out phase. I said, you said it, not me. So let me just tell you that this person who referred them, who is a long-standing client of mine, yes, she's white. And she's a Republican. No, she is a never Trumper, but she is white. She does understand that what the ACA is because she's a client. And she sent them to me because she was like, Nicole will get you all the way right, but not these clients. So I'm sure they're going to give her a call, and she'll have the information that she needs to make sure to set them all the way correct. So it made my heart smile to send somebody on their way, and they're in the find out phase of the FAFO. That's all. I was like, I got to share. So, my black women, enjoy yourselves.
Why am I paying $500 a month for health insurance that doesn't want to cover anything? Every single time, new medication, this, that, they're like fighting everything. They don't want to pay for it. They say, oh, you need this. It's like, I thought having better insurance meant things would be easier. I don't know what's happened. I know health insurance has always been kind of scammy, but like in the last 5 years or something, or even more recently, I don't know if it was from COVID or what, but it's like they don't want to cover anything. They are just shamelessly stealing people's money. And I think the worst part about it is when you see these commercials and these ads and they're like, we care about your health, or like, Blue Cross, like we care about you, or Healthy Life, or Kaiser, all these people that are saying they want to help you and they want you to be healthy. They don't. They really don't. They just want your money. They don't want to pay for shit. To add insult to injury, when you get the bills of these things, they just mark everything up like the most ridiculous stuff. It's like a spit test or something like that. And they're like, that was $40,000. We saved you $40,000. It's like, On what planet was that actually $40,000? They're just making these numbers up to say, oh, see, you had these savings. It's like, no, I had to pay hundreds of dollars for this test. Anyways, when the test probably cost less than that, but you're saying it costs, this insane amount of money. Everything's, they're like, well, we saved you 10,000 here and da, da, da. It's like, no, you didn't, man. You're just cooking the books. Like, just stop, just stop.
So MAGA, you're upset now because now you're finding out that Obamacare and the Affordable Care Act are the same thing. You voted to get rid of Obamacare. I guess because you thought Obamacare was only for you know who. Not knowing that the Obamacare and the Affordable Care Act are one and the same. It was the Republicans who told you and gave the Affordable Care Act the nickname Obamacare. They did it to scare you, and you fell for it. So you voted out of hate to try to get rid of something out of hate. But now you're not going to have health insurance because he has been trying to get rid of the Affordable Care Act since his first time in office. And now that he has no guardrails, it's gone. He's going to try everything in his power to get rid of the Affordable Care Act. So all of you who voted to get rid of Obamacare, you just lost your damn insurance. Oh well, I guess you live and you learn.
So a lot of people on social media today are learning that the reason they have health insurance today or in previous years is largely because of Obamacare. And the reason we're realizing this today, it is the 14th anniversary of Barack Obama signing the Affordable Care Act, the ACA, into law. But as those posts suggest, and as a lot of comments on my videos, especially the one I'll link here on ranking America's presidents, suggest a lot of people don't really know what's in the ACA, like what it did, what it does, and what the outcomes of it are, and why Republicans have failed to repeal it but are still really trying. So let's talk about it. Now, first of all, any kind of healthcare reform or health insurance reform act that actually got passed in the United States was a really big deal, or as the current president called it. And that's in part because American presidents have been talking about trying to reform Americans' access to healthcare for about a century at this point. And we've seen efforts by FDR and Truman and JFK and LBJ, though he did get Medicare and Medicaid through, and Carter and Clinton all go down in flames. And many of those programs were actually opposed by the American Medical Association, the AMA, which accused these programs of being socialized medicine and lined up their troops against them and got a lot of American people very scared about these programs. But the AMA endorsed the Affordable Care Act in 2009. It was a big win, and one of the reasons they do endorse it is because this is not a super liberal program. Barack Obama moved to the right as far as Democrats were concerned on health insurance programs, and he picked up what had been the Republican plan for health insurance reform. This is not Medicare for all. This is not single payer. This is what had been the Republican alternative to those Democratic plans. Republicans like Richard Nixon, Newt Gingrich, and Mitt Romney had supported these types of plans in the past, which is one of the reasons it was really difficult for Romney to run against Obama in 2012, because he had set up an Obamacare-style system in Massachusetts that worked really well, but now he was arguing that Obamacare doesn't work and running against it. What is actually in the Affordable Care Act? I'm glad you asked. So there's 4 big things you need to know about Obamacare. First, it required proof of health insurance, or you would have to pay a tax penalty, and this is called the individual mandate. It mandates that all individuals have health insurance. Does what it says on the tin. It also says that insurance companies can't really charge sick people more than they would charge a healthy person, and that is basically how insurance companies had worked. They would raise prices really high for people who were disabled or sick or high risk, and then that would keep them out of these insurance plans, and that would keep prices low for all these healthy people, and that's how they made money. Now, the idea of Obamacare is the opposite. Instead of kicking those sick people out, we're going to keep all the healthy people in, and the idea is this would keep insurance companies from going through that whole death spiral where they would just collapse. Now, the Affordable Care Act increased Americans' access to health insurance in 3 different ways. Follow me to part 2 for that.
Here's something Republicans don't want you to know about. It turns out that when my husband retires, we'll be paying less money for health insurance than we were paying under his employer's health insurance plan. You know why that is? Obamacare. A lot of folks don't retire early because they don't understand that Obamacare can possibly provide cheaper health insurance than what they're currently. And we know that in this country, health insurance is tied to your employment. What do I have to say? Thanks, Obama.
See how people are excited that Obama, you know, came up with the whole Obamacare Act. Okay, that's the Affordable Care Act, and he was able to help them and their families. Okay, have a cheaper insurance, but these other people are voting against it, knowing fully well that it's also going to benefit them. But they never knew it was Obamacare that is ACA. They just felt that, oh, let's get to these people. Let's do something that will make them feel it. Let them feel the pain and all of that. Feel the pain for what reason exactly. And at the end of the day, you are the one suffering for it. You're the one paying for it. You didn't ask question. You didn't know that you're going to be spending more on your health insurance, knowing fully whether health insurance can really be expensive in the US. And right now, every other person is going to feel it. It's quite unfortunate that even the people who didn't vote for TP is also going to feel the whole thing. And the worst part of it is the fact that he doesn't even have a plan, no concrete plan till now. We just have concept of a plan without a plan. Nobody knows what the plan is. It's just a concept. Okay. Anyway, guys, let me know what your thoughts are in the comments. Okay, let's have that conversation in the comment section. Please do well to subscribe to my channel and do give this video a thumbs up. Bye, guys.